Brimhall with us. Again, Zymogen Board of Advisor member and founder of the bioenergetics portion of Zymogen. So Dr. John, welcome back.
Well, I thank you, and as usual, I'm having a little trouble getting the slide to move, so every time we have something with that, I'm not sure what to do about that. Is there something I have to do to get that to go forward or backward?
You know what I often do, Dr. John, is at the bottom left-hand portion of the screen, you see a little forward arrow. I let you use that, or you can use the keyboard on your...
Usually once it frees up, that got it to me, so I think we're okay. Thank you. All right, I'm ready to rock and roll. Well, welcome, everybody. Today is kind of a continuation of what I've been doing, and you can see it's on detoxification. And you might think I'm stuck on something. Why does this guy keep talking about detox? Well, I tell you what really inspired me to do it this week is that I listened to the methylation presentation. If you have not listened to that, that doctor is phenomenal. Mike did a great job of introducing me and recording that, and he sent me the recording. You need to listen to it about 50 times. It is an amazing presentation of methylation. Please understand, the first thing we do as a human being is oxidation reduction. We take in the food, we take in oxygen, we burn it, then we have to get rid of it. The second most important thing we do is methylation. And one of the most common blocks of methylation on the planet are toxins. I'm going to talk a little bit more about that, but let me come in with a disclosure here right to begin with so we make sure it's me talking and you don't think somebody else's ideas are going to come out here. I am a member of the Board of Advisors, and I did, in fact, formulate the bioenergetics formulations, and we're expanding those. You're going to see a doubling of that happen here in the next 30 days. It's very exciting. My staff is going to take over more and more responsibilities because we want to go worldwide with the bioenergetics division here of Zymogen. I do have a financial interest in this. I'm going to really hammer home this with you right now. I am a millionaire. I made $1 million a year in doing what I'm going to teach you how to do. I'm thinking I should do a puzzle piece called Cash is King, because we need to help people. And the way you grow a big practice is to help people. In helping people, they pay their bills, and that adds up to $1 million. It did for me, and I never was a money-focused person. I'm still not. I'm a help-a-person focused. And by doing that, you can help people no one else is helping because they're not looking at all 6 interferences that people have. And that's what we teach in our seminars. That's what I stand for. And I do make money doing that, and so can you. This is a disclaimer that talks about what I'm representing to you is mine. This is my material. I am a practitioner of 42 years. This is not Zymogen's ideas. The formulations they made under my recommendations because of formulating over 150 different products through the years. And so they want you to know what I'm saying is my opinions and it's my clinical experience, and nothing we say it has anything to do with a cure of a disease. But I'm going to show you how if you're not taking care of the toxins that are in people, they are going to have a disease and they're going to have a disease. And that's documented in the science. So it comes from everywhere. And these particular slides are going to be available. We're recording tonight. Sarah Adams from High Tech Health put these together for me, for you, and there's going to be far more than I can go into in detail that these are available. I'll give you her contact information at the end. They can talk to you about the sauna units that I use, and they can talk to you about these slides and presentations so you can educate the people in your area. Now, the main thing that I see is I'm training doctors. I mean, it's really crazy that I ever started teaching. I had an incredible practice. I had 50 to 70 new referrals a month without advertising. That was my patients talking to other patients. I was booked 3 to 4 months in advance. I couldn't get anybody in any faster, even though there was 4 DCs in the practice and a PhD to go over the nutrition and do our allergy testing with what we use now is called the ASA. It was a predecessor to that. And we were working around the clock. We literally did $300,000 a year in nutrition. We did $1.2 million in collections, not services, but collections. And we did this because of my passion. I was paralyzed from the waist down. They carried me into a chiropractor, and I walked out. I was going to be a dentist at that time. That was in 1970. By 1971, I was in chiropractic school. That was in 67. In 1968, I was in chiropractic school and went around the clock, summers and all, and I just wanted to help other people like I was helped. And the more people I helped, the more complicated it got to help them as time goes on, because it isn't just a subluxation, it isn't just one nutrition they're deficient in, it's a combination of the spine being out of alignment, craniosacral injuries, scar tissues, emotional stressors, toxic accumulation, electromagnetic fields. And so we developed an entire protocol called the Brimhall 6 Steps to Wellness, a 6-step protocol that evaluates patients and treats patients. But if you're not taking your nutrition, if you're not getting adjusted, if you're a chiropractor or an osteopath that does that, then how can you talk to anybody else about it? If you haven't been in your infrared sauna today, or at least this week, how could you dare talk about it? So I was in my infrared sauna for an hour today at 137 degrees. I was in a foot bath at the same time. I took Helix before I got in. I took my halogen this morning, turned out to be chlorine. I follow my talk. I walk the talk, and I want you to do the same thing, because I just buried a member of my family at 53 years old because they didn't obey these rules. He smoked since he was 15. He used marijuana. He used alcohol and to excess. So my youngest brother, 53 years old, I attended his funeral last week. I'm 66, and I work about at least 60 hours a week, and I enjoy it because we are saving lives by looking at the research, looking at the literature, seeing the patients that nobody else is helping. You do hair analysis on them, do blood studies. We're doing kinesiology. We do everything it takes to evaluate that patient and to treat them. And the reason I leave that now in the beginning is because when I listen to the methylation presentation, I realized to be able to understand everything that he does, it's taking him a lifetime, number one. Number two, he's spending evidently hundreds to thousands of dollars testing patients to know what he needs to know. And I'm going to tell you a sequence in kinesiology that we use to pretty well pinpoint. Do you need 5-MTHF, methyl tetrahydrofolate? Do you need Methyl-Protect? Do you need SAMe plus DMG? Do you need Xenoprotect as well? Do you need? And so we're going to talk about that. But let me show you why you need to even understand that this is a problem. It is a big problem. This is what we look like when we go into our grocery store. And if you're shopping in the center of the grocery store, you're getting garbage after garbage into your system. The outside of the grocery store has the fresh fruits and vegetables, but they are loaded with toxins too. So let's look at that. The dangers of toxic deposits in your body are about any symptom you can come with. But let's start at the top. From memory loss to blurred vision, central nervous disease, back pain, unexplained weight gain, testosterone, estrogen problems, bowel problems, joint problems, those are all from toxins, or can be. This is why we cannot ignore these type of problems. Toxic exposure are unavoidable. The EPS makes there's over 70,000 chemicals used in agriculture and building materials. 70,000 you're exposed to on a daily basis, most likely. 3,000 chemicals are approved for our food. These are chemicals, not nutrients, not 3,000 nutrients, 3,000 chemicals that binds the nutrients that doesn't allow your body to use them, or actually causes a codon change. Our polymorphism can be what we're born with, but you can get a genetic inhibition, or you can get a polymorphism where you need more B12, more folic acid, or an inability to convert your Bs, and that's where Zyman and biointerjects are so good, because they've done the research to find out what nutrients need to be broken down at a greater level in case you have the SNP, you can still methylate, you can still detoxify. But these chemicals we're talking about bind that. We need to release them at the same time we're using great nutrition like NRF2, but NRF2 can even be bound up with the heavy metals, the pesticides, the defoliates that we're going to talk about. There's over 10,000 chemicals used in food processing and storage alone. 10,000. Now, if we go back even 100 years ago, much less 200 years ago, there wasn't all these pesticides and herbicides and most of these chemicals we're talking about. From 1999 to 2004, the Center for Disease Control Prevention found there was 219 different chemicals in the blood and urine. 75 had never been seen before in any study previous to 1999. Do you understand what I just said? 75 new toxins showed up in the body in that 5-year period. And that was 2004. This is 2013. We're 9 years more toxic accumulation from there. From 2007 to 2008, the Environmental Working Group detected 287 chemicals in the umbilical cord of newborns. I pretty much remember, I have a pretty good memory of my early schooling, and I think they told us babies were born pure. And that is not true. If it was true 42 years ago or 48 years ago when I started this journey, it certainly isn't true in my 42 years of practice. 287 chemicals in the umbilical cord. 180 are known to cause cancer in the humans. So how would we expect babies to be born healthy? And giving them a drug doesn't detoxify them. So I mean, we have twins that are 2.5 years old. Even though I'm 66, I have 2.5-year-old twins. And I took them to the pediatrician to make sure everything was good. I never did my other children, but I do now. My wife's 35 years younger than I am, and she's more of the Y generation. So, but they have not had to have drugs. They haven't had the inoculations. They didn't have any they have not had any ear infections at this time. They didn't have colic. Were they on probiotics? Yes. Were they on enzymes? Yes. We use Zymozyme with them, and that type of a multiple enzyme as they go along. We give them nutrients every day. I adjust them every month. I check them on my ASA every month and find there's allergies and toxic accumulation in these little guys. And so we test them and treat them every day. We give them the halogen detoxifiers every day, and we work with that situation, not only with us. My wife is 31, I'm 66, and they're 2.5. Every day we detoxify. I was in a foot bath last night. I did a foot bath this morning while I'm in my infrared sauna, while I'm lasering myself. That's how important I think this is. It's the only way I can work 60 or 80 hours a week. In 2009, the fourth National Report of Human Exposure to Environmental Chemicals was released. This was the fourth report, and it said 75 new chemicals measured for the first time in the U.S. population, like we alluded to a minute ago. And these chemicals are things like acrylamide, glycemides, arsenic, phenols, bisphenol A. These are really bad, and a lot of the perchlorates. And you're going to see a lot of the chemicals and toxins that give us problem have the halogens in them, like perfluorinated chemicals, polybrominated diphenyl esters. Chlorine, fluorine, and bromine are binding up your iodine every day. They're making your body toxic. Through bioenergetics, we have homeopathics that we give our patients. We take ourselves daily. I check each one of us, all 4 of us, every day to see if the body is calling for that. Take 1 to 2 drops under the tongue. At the same time, I'm taking Xenoprotect to make sure I have the right nutrients to help get rid of this. I'm taking Chelex. I'm taking Lipocol every day. I want my phospholipid that surrounds my cells to be extremely strong and help to get rid of these toxins, the heavy metals and the bad fluorinated and brominated diphenyl esters, and they're everywhere. You're getting them every day. You are sitting on one right now, probably, or both. Volatile organic compounds are very bad. Some additional chemical groups previously measured were also discussed. Environmental toxicity continues to get worse every year. Please understand that. We are bioaccumulators. As humans, we do not have the ability to get all this stuff. We don't know how to get rid of it. So we accumulate, and it builds in our body and gets stronger and higher dosages. And this, in fact, does cause illness and disease. According to these authorities that I'm stating, the Columbia University School of Public Health reports that 95% of cancer is caused by diet and the accumulation of toxins. And one of the reasons is it binds up methylation. It binds up your ability to detoxify. So if you have any of these problems, from memory loss to allergies to irritability, when did you check your environmental toxins? When did you check your internal toxins? What problems might you have? And the physical symptoms and the psychological symptoms and are just listed here over and over and over. So I'm going to go through some of these very, very fast. There's no way to go over all of them in the time that we have, but we want them there so you could go back and review them. And again, I'm sure that HITECH would be happy to furnish these for you if you would like to do a presentation. And they're pretty self-explanatory. It tells you the bibliographies where this information came from. But the air pollutants, according to the Wikipedia, 187,000 hazardous air pollutants right now that we're dealing with on a daily basis. The chemicals are pesticides, the phthalates, DDT. You say, well, we don't use DDT anymore. Well, I guarantee you they do in Mexico, and most of the fruits and vegetables we get here in Colorado and in Arizona, come from Mexico. So hydrofluoric, there's that fluorine again showing up, acids, chlorine, methyl alcohol. A lot of medications besides pesticides, etc., have these chemicals in them. And of course, heavy metals are rampant there and everything. We'll go over that towards the end of the presentation. So these air pollutants you can see are around us all the time, whether it's the cow in the pasture, the car we're driving, or the toxic accumulation at ground level, or all the different things we're getting in our house. I asked Sarah to go ahead and give me a little more detail on that last picture, and she's amazing and came up with the greenhouse effect was number one, particulate. So we're getting carbon dioxide from exhaust from the energy production, methane from cattle and from the breeding of cattle, sulfur oxides from exhaust and industry. The CFSs, that's that chlorofluorocarbon. Chlorine and fluorinated carbons are incredibly toxic to us. Fluorine is the most active ingredient on the periodic table. It displaces everything. It mixes with everything, and it poisons your system. From chemicals, from refrigerants and other propellants, is where you get chlorofluorocarbon. Nitrogen oxides from exhaust and industry. Ozone from air and high oxygen levels catalyzed by nitrogen oxides. The soot and particulate comes from exhaust and industry. The greenhouse effect is by the sun warming the Earth's surface and reflecting back into space. Particulate contamination is affecting our respiratory system. We have a lot of particulates, a lot of toxic particulates in our atmosphere right now. We now have, from a reduced ozone layer, high UV radiation levels. We have acid rain. It's literally killing off some of the good plants and good animals and insects, and leads to acidification of our whole area, particularly the rainforest. Increased ozone levels affecting respiratory systems. Ozone is a good thing to kill off the bad guys, so you can use an ozonator in your house, but you always have to air it out. So this is being increased, and we're inhaling this, and it's causing illness in the body. Contamination by nitrogen oxide. This affects our respiratory system a lot. So the global air pollution, we put that in there for you to take a look at it. Deaths from air pollution here, and you can see the different colors go up through here. When you get into red, is much higher. Most of Canada and the United States is in this color here. That still shows you the 150 to 250 deaths per million population. Air is important. We get rid of 80% of our toxins from the air. When you sweat normally, you only dump 2% toxins, but if you can heat the cells from the inside out with infrared, and then you actually dump up to 15% toxin. This is why I don't want to go a week without doing infrared sauna to help build up my ability to detoxify. This again comes with Wikipedia here. Air pollution is the introduction to the atmosphere of chemicals, particulates, or biological matter. So they cause all kinds of discomfort and dis-ease in the body. Towards the bottom here it says primary pollutants produced in human activity includes sulfur oxides, and a lot of us have trouble with our sulfur metabolism. That's one thing that we evaluate and treat in our patients. Nitrogen oxide, carbon monoxide, and you really want to have a sensor in your home. You make sure that your car is well ventilated, and also any gas stoves or anything that you have in your house. Toxic metals, chlorofluorocarbons we talked about, ammonia, other odors, radioactive pollutants. It goes on and on. But look at you keep seeing that chlorine, fluorine, and bromine keep showing up over and over and over. And so we have something through the bioenergetics, homeopathics to start getting rid of that body. If you've not followed our protocol with that, I've done a couple webinars on it. Please go to brimhall.com. That's BRIMHALL.com. And Jason and Solitaire are there. They think 24 hours a day, but they're starting at 7 in the morning Arizona time until 4 in the afternoon. And they can lead you to the website, put you on what we call the puzzle piece. Every week I write an article on things that you can do, or case histories of helping yourself and your family. So all of that is totally free of charge. It's our give back to the community so they can learn better how to help themselves. I do seminars pretty much going to be every week to every other week here through almost the rest of the year. So look at those. We teach you how to evaluate these with blood testing, we have a co-op blood testing that we teach you how to do. You can actually buy a $1,500 test for $150, $160. Hair analysis, the comparison of the two with computer printouts. That's some of the things that we're teaching in our seminars. Please evaluate your patients. But we also integrate kinesiology, muscle response testing, along with our physical findings, symptomatic surveys, and by putting those together, we're able to help people and see things nobody else has seen. Chemicals include volatile organic compounds and chemicals. They're used in pesticides, herbicides, inorganic chemicals, and radionuclides. Well, where can you go where there hasn't been pesticides used or herbicides? You say, well, I'm at my house. I'm safe. Really? Have you watched everybody spray that crap up and down the alley? And even though I live on 3.5 acres, people around me are spraying that. And if they're spraying 10 miles away and the air currents are coming this way, I'm still being bombarded with it. When I go to the store and buy groceries, unless I raise on my own, I'm getting all of these different pesticides, herbicides, and chemicals. Chemicals produced by human activity, literally our own bodies make sulfur oxides, nitrogen oxides. Oops, sorry, bounced that there. Volatile organic compounds, particulates, persistent free radicals in our body.
Welcome to GoToWebinar, Web Events Made Easy.
Really watch that. And particulates, persistent free radicals, toxic metals, chlorofluorocarbons again, ammonia, these are all being made in our body, and our body has to get rid of it. In the air itself, though, talking about from the inside, outside in again, formaldehyde makes up 14% of our composition that we breathe in every day. Butadiene, benzene, acetaldehydes, acetylene, DBMs, and you can see the idea of what kind of toxins we're breathing in on a day-to-day basis. So we have human-made sources, including mobile sources, automobiles, our own endogenous sources, but there are literally 10 tons per year of toxic pollutants in the air, 25 tons of a mixture of air. And just to show you a picture of this, non-road toxins that are in the air are 15%. On-road toxins are 28%. You say, well, where do you get toxins on the road? Well, that's pretty easy. Where do you think all the tires go? You have to buy new tires for it. You're breathing that area in. You are in the carbon dioxide, the carbon monoxide, incomplete combustion of the fuels, be it gasoline or the diesel. Exposure to air toxins, again, breathing in. Eating contaminated foods is another place that you get it. You eat fish, fish have been exposed to mercury and other things, you're picking it up. Fruits, vegetables, drinking water that's contaminated. You say, well, I drink pure water. Well, I hope you drink purified water because they're finding contaminated in the water sources a lot of the things that we're talking about today. And the lesser expensive water purification systems don't even come close to getting it out of there. So again, go to our website. We use one called the Dana water system. In my home, I not only have reverse osmosis that has multi-resistance filters going through it, but we also have a whole house system. So we don't bathe in chlorine or fluorine or bromine. We have it all taken out. And it's a special whole house system that, again, is on the website. There's so much information there for you to glean from. In the seminars, too, we have a book that we hand out that tells you the different areas that we have found to be most helpful. Contaminated soil is everywhere around us, and of course, touching, breathing, and drinking or eating is all the different areas that we have there. I think you just heard one of the 2 years old trying to find out where Dad is. There's some of the air pollution health risks here. It's dependent on how much level you have. So you want to purify your air. So in our home, we also have air purification systems besides water purification systems. But you wind up with just lesser exposure, skin rashes, cough, headache, nausea, and dizziness. More serious, asthma, chronic bronchitis, kidney and liver damage. But also cancer, nervous system damage, miscarriages, birth defects, and death have been documented from air pollution and toxic contamination from food and air. Chemical compounds are everywhere, as we talked about. There are estimated now to be more than 300 environmental chemicals and their metabolites measured in human samples. Urine, blood, serum, breast milk, and meconium, 300. Over 70,000 chemicals being used commercially in our country, and 65,000 of them are being labeled hazardous to our health, but they still allow them to be there. Toxic exposure, again, a visual of what we've been talking about here. You can see it's affecting all parts of our body. So many things go to the liver. The liver has over 500 functions, and many of those have to do with detoxification, and the liver is not able to keep up. So one of the products that I use every day myself and recommend to the vast majority of my patients is Max Liver Detox. So it has an array of nutrients that helps the liver through all the different phases of liver detoxification. Also, I take probiotics every day because the bowel is 80 to 90% of the immune system. So daily, we want to take probiotics, enzymes for improved digestion, liver support. Chemicals also like acetaldehydes are an incredible source of contamination to the body through alcohol, wood stoves, incinerators, smog, diesel exhaust, and fungal infections. Now, literally, the acetaldehydes affect the DNA and cause chromosomal damage. It binds to the liver and other cells, causing autoimmune conditions. It affects upper respiratory, metabolic disruption, and lung damage. Just one chemical. Now, I'm going to start talking faster and faster as we go along here because there's so many things to cover, and a lot of these slides we're just going to have to let you go back and really dig into later on. But I'm going to go over it a little bit in slow motion for me. Most people talk about 200 words a minute. I talk about 800 words a minute with bursts up to 1,000 as we get more information here. But the benzenes, you get them from gasoline, all kinds of exhaust to anything to do with burning petrochemicals here. But also propylene food containers, cooked foods, printers, copy paper, copy machines, incinerators, tobacco smoke, wood smoke, marijuana smoke. The effects are bronchial, colon, liver. There's that liver again. Even leukemia, DNA damage have been documented. Tumors, including brain tumors, liver, stomach, lung, cardiac abnormalities, eye irritation, drowsiness, unconsciousness, lack of coordination, heart attack have been directly related to benzene contamination. And there's no way you have not been contaminated today, unless you live in some kind of a bubble I don't know about, because you do eat out of cooked containers. And probably I have a printer right here in my office, even though I've ventilated, and we use copy paper today. Went in the car, and I have a diesel. Brandy has a gasoline, and so we are being affected every day. That's why it's so important you use nutrition, foot baths, detoxification, exercise, infrared sauna, laser, everything you can. Daily exposure to benzene, as you can see here, is really quite high. And when you smoke, it raises it clear up to here. And unfortunately, my little brother smoked every day and wound up with a cancer that took him in 60 days. If you're going to play, you got to pay. Nobody else in my family ever smoked or drinks. It's against our religious code. He chose to ignore that. And in smoking, look at the increased risk, 1,800 down to only 200 on a typical day of accumulated. We're only talking about one thing, benzene. We're talking about fluorine and chlorine and benzene and lead and cadmium. You add all these together, it's amazing any of us can be considered healthy. It's amazing that I can work a 40, 60, 80-hour work week at 66, and it's because I walk my talk. That's why. I don't wake up tired. I wake up energetic and ready to go. And Brandy has to stay in the time to go to bed at night. And, of course, I'm motivated. I love helping people like I was helped. Let's go to another one, BHT, butylated hydroxytaurine. You say, wow, I've heard of BHT. What the heck is that? Well, it literally has a migration from polyethylene food packing, and that's a lot of food you get is packed in polyethylene. It's additives in foods like cereals, fats, meats, potatoes, cosmetics, and other things. What does it cause? Allergies, possible cancer, kidney damage, on and on and on. So here's just a typical food on a daily basis that was taken off a label. Here's BHT right in here. So learn to be a reader. I go to a health food store and get a lot of our things there, but I notice when you go over to the meat section, I'm not a vegetarian. I tried to be. I just didn't have enough energy, and so I try to be a very smart person who eats good things and organically raised foods and fruits, including meats. But I notice even on the turkey in the health food store or chicken or meat, you can look at the label, and some of them have nothing but the meat on them almost, and then others that have a label just like this that have all this different garbage in here, gluten and sugar and canola and rice bran and fructose. You understand what I'm saying. Read the labels and stay away from those. If it takes you more than 3 or 4 minutes to read a label, that's too much, isn't it? How about even 3 or 4 seconds? Sources of chemicals, I mean, you name it, it's there. From the food that we eat, from the clothes that we have cleaned, to horrible bombing that has happened in the northern part of the United States and northern part of Arizona. All of those people, including my family, was irradiated with atomic weapon testing. The government did testing from 1951 for 11 years. And those people have Downwinder syndrome, which literally caused mutations of the genes. And they've died by the hundreds by mutations. They're cancer-protected genes, like cytochrome P450, or tended to cancer-producing genes. So that takes genetic evaluation to do that, which also we have done quite an extensive study on that, and that's a whole other topic. So here you go, the volatile chemicals. It tells you of what has happened here, and you can see all the different diseases and diseases that happen from both soluble and volatile toxic exposure here. So as you look at some of the carbon monoxide poisons alone, road vehicles emit 45%, smelters 3%, transportation 40% unrelated to road, other industrial processes 5%, and residential miscellaneous about 7%. But it's coming everywhere. And a lot of us drive and fly almost every day or every week, and we are being exposed heavy duty to these. I mean, I'm sitting in the jet. I just got back from Nashville. I had to think where I was last, and Lincoln before that, and we're on the way to Phoenix here very shortly. And I fly a lot. And flying gives you all kinds of electromagnetic poisons, inhaled poisons. You just have to work daily to detoxify this. But you crank up those engines, they still have a door open. You can smell the toxins coming in there. So my carbon monoxide levels, here's some graphs you can look at on your own, but showing that there's a lot of different ways we can get carbon monoxide poisoning. Okay, let's go to another, chlorobenzene pesticides. Everywhere. I don't care whether you're in America or other countries, it's documented that we are being poisoned by chlorobenzene pesticides. DDT, lindane, patachlor, aldrin, you name it. They're all over the place. And if you look again, there's chlorine, boron, formine, and all of these, especially have chlorine in them. And those bind up, get in the body, bioaccumulate, stop your iodine from getting in, so your T3 and T4 are T3 what? T3 tyrosine, right? Or tyrosine with 3 iodine? I think not. Chlorine, fluorine, and bromine on many people. And so there's a whole study that's been done on that. Read Iodine by Brownstein. Why you need it, why you can't live without it. Another presentation I've done a webinar on, and we teach the evaluation and treatment in this, and it changes lives for the good every day. I mean, there's just many people we're able to help by evaluating chlorine, fluorine, and bromine. Also lead, mercury, copper, other toxicities that we evaluate and release with the bioenergetics homeopathics. DDT and DDE, just showing you in the breast milk where it is, and you can see some of the areas is very high, like Mexico, and much of our food comes from Mexico. But even the United Kingdom, the United States have measurable DDT and DDE. Other chemicals we have to worry about, chloroform and carbon tetrachloride. Chloroform is actually just putting chlorine in the water, some chloroform is made. It's also in solvents that we use around the house and in industry. Incinerators, groundwater is being contaminated now with chloroform. What does it affect? Liver, lung, enzymes. How many enzyme systems are there in the body? 5,300 enzymes. Last time I read Dorland's dictionary, 5,300 all affected by carbon tetrachloride and chloroform, which we're getting in our water systems and incinerators and solvents that we're exposed to on a day-to-day basis. Heart, blood vessels, developmental issues, nervous system, reproductive system, and a known carcinogen. And you say, well, why don't we just do away with all this? Well, we change the way we live. And we like fast, and we like green, and we are poisoning ourselves. We need to be better well-informed, and we need to be daily detoxifying ourselves. Even if we don't use any of this, we're getting it through food, air, and water. And again, you see the chlorine in this particular chemical, which is used as an insecticide. If you walk down the street, people are spraying defoliants and insecticides on their grain grass. I mean, you just can't stay away from it. It's unbelievable. Well, this chlorine derivative chemical, what does it affect? Well, peripheral nerve damage, autoimmune disease, and antibiotics and allergies, allergy to antibiotics, memory loss, multiple chemical sensitivities, headaches, nausea, muscle cramps. Effects are accelerated by other organophosphate pesticides. So again, chlorine, fluorine, bromine, the heavy metals add to all this. So all these are cumulative. It's not like we're dealing with just one chemical. I'm only going over a dozen today, but there's hundreds. There's thousands we're talking about in the whole system here, but we're talking about several hundred we're introduced to and contaminated with on a daily basis. Here's your phthalates, DEHP, diethylhexyl phthalates. They're plasticizers. So anything to do with plastics like PVC, I mean, I started saying that word when I could barely walk because my dad was in construction. Hand me that PVC pipe, son. And so we've played with PVC. We've cut it open. We've burned it. We've done all kinds of things with it. You've made systems out of it, like part of your sewer system is out of PVC. You are exposed to it all the day on. Packaging, tubings, even medical tubings, cosmetics, lacquers, industrial lubricating oils, pesticide carriers. I mean, you say, well, this is redundant, Brimhall. You keep saying the same thing over and over, but just a little different twist. That's right. Different chemicals we're exposed to. But I want you to catch the effect of this, how acute effects, gastrointestinal nausea and vertigo, lung irritation, chronic damage to the lung, liver, and testes. And so the cancer has even been shown with a lifetime exposure to DEHP or PVC pipe and the other things that it's put into, which is me. I've been exposed to it my entire life. So if I wasn't detoxifying, I wouldn't be running around full of energy like I am right now. How about the dioxins? They're everywhere. Pesticides, herbicides, water, meat, fish, especially in fat and liver. Incinerating anything and burn it, you're exposed to them. Electrical fires, wood smoke, chemical reactions, even sewage sludge. We live on 3.5 acres here. Everybody has 3.5 acres. There's only 11 houses in this area that we live in, and we have 80 common acres, so we all have the equivalent of 10 acres. We have a big meeting of the HOA here this week, and one of the septic systems that we're on went bad on one of the houses, and so we're being exposed to this kind of a problem, even in living in a nice secluded area through there. So you can imagine smaller areas where they're really crowded, septic systems if you're on that, but even the sewage systems can get backed up and you're exposed to dioxins. Dioxin can cause reproductive problems, genetic damage, and on and on. When I first started in practice, I was 24 years old. And when anybody ever talked to me about not being able to have kids or they have erectile dysfunction, they're like 60 years old, maybe in the 70s and 80s, that type of thing. Now, 20-year-olds, couples come in, cannot have children. You check the male, you check the female, the male sperm count is down. They're swimming backwards. They're going the wrong direction, literally. There's all kinds of problems that are happening out there, and a lot of it comes from the chemicals and the toxic exposure that we have. And again, here's a visual picture you can see from dioxins to incinerators to PVCs, kind of what we've been talking about in picture format. Here's another one, ethanol. Ethanol comes from glue, alcohol, colones, ethanol ETOH, grain alcohol, etc. And it causes anything from fetal damage to developmental delay, neurological damage, liver, metal deficiency. The good guy, like zinc and selenium deficiencies, are put into trouble and to compromise with the ethanol. So the styrene, xylene, taurine, methyl, ethyl ketones, and we'll talk about those a little bit later. The U.S. ethanol production has gone up because we're burning that in our cars. A brand new car can use ethanol. World ethanol exports, Brazil and the United States manufacture it here and ship it over, so we're being exposed that way as well from production here. Formaldehyde. If you went through, you're a medical doctor, you're a chiropractor, you're a dentist, you went through formaldehyde where you had to do dissection. And there's formaldehyde in many things like solvents, painting, fabrics, mattresses. You can read it all yourself. Pressed wood. We're having formaldehyde come out. It's a new house. We just built it. Just been in it 2 or 3 months now, and you can actually smell some of it coming out. So we did everything we could not to put those kind of things in our house, but you cannot buy a mattress that does not have formaldehyde in it. You cannot buy a mattress that does not have bromine in it because they have flame retardants. It's against the law to sell a car. You don't have flame retardants in the car. That's that new car smell you have. You fly in an airplane. They dose that every so many air miles with flame retardants, which are full of bromine and other toxics. So it goes on and on. Formaldehyde is a known human carcinogen. It affects the lungs, memory, dexterity, asthma, rhinitis, eyes, rash, cancer. So again, one more thing. So in your home, if you even have an older home, this is happening, especially with the pressed wood they use and things like that. But your flooring, all of your chemicals that come out of your computer and your speakers, those all have formaldehyde in there. Just take a look at this picture. Indoor concentration of formaldehyde, you can go back and look at that, but it's in the flooring, carpet, ceiling, door, closet, desk, table, chair, shelf. I mean, it's everywhere. How about glycol esters? Where do they come from? Resins, lacquers, varnishes, gum, perfume, dyes, inks, paints. Well, you think you don't have any of those in your house? Of course you do. Caulking compounds, printed circuit boards, antifreeze, we're introduced to it every day. Again, affects the reproductive areas. Again, chronic exposure can lead to anything from fatigue, chronic fatigue, lethargy, nausea, anorexia, tremor, and anemia. So you can kind of see the flow here through the glycol esters to gene regulation to genetic and epigenetic abnormalities. If you don't really understand that genetic is what your genes are, epigenetic is the expression of the genes. And what we take nutritionally, and a lot of the good nutrition that we use in bioenergetics, manufactured by Zymogen, is designed to help you epigenetically to manifest the very best way you can to help the body to overcome all the things that are happening in there. But the glycol esters alone cause male problems, testicular atrophy, epididymis, prostate, seminal vascular, testicular cancers. In the fetus, all kinds of problems can happen right there. In the female, everything from hypofertility into an inability to get pregnant or to carry the child. Here's another one. Carbon, hexa, chloro, there's the chlorine again, benzene. Cleaners, fungicides, toxic fumes, decomposition of some of the things that are going on out there every day. Affects the liver, reproduction, developmental areas, is carcinogenic. Immune suppression. So, you know, it's interesting. I get emails every day. We do the puzzle piece every week where we are answering doctors' questions. We're going over case histories. And they will say, I have this patient with high liver numbers. What do I do? And I tell them all 6 steps. Adjust the person, of course, because if the liver can actually drop down, if the ligaments of trite let go, the liver can be in a torque position. It can be locked up through infection or through trauma. You can have a scar affecting the liver. We do visceral manipulation. We do cranial manipulation. We do spinal adjustments. Do that. But what if they have hexachlorobenzene? What if they have been used a PVC pipe? What if they wash their hands in leaded gasoline? I'm old enough. We used to wash and clean everything in leaded gasoline. What if you played with mercury when you were a kid? I mean, anytime there was mercury around in science class, we played with it. We have been poisoned our entire life. You cannot just adjust if you're a chiropractor, expect the body to hold that adjustment and to be able to detoxify all this. You can't just give a nutrition. You have to evaluate what nutrition they need to upregulate their detoxification system. You have to give them the right nutrients like molybdenum. Molybdenum is a massive deficiency. You can't do phase 2 detoxification of the liver without molybdenum. So in the iodine, max iodine, we have selenium and molybdenum besides iodine to allow the body to uptake and put in the system. But we also make sure that we've detoxified them from chlorine, fluorine, and bromine before we try to get the iodine in the body. You say, well, this is too complicated. And I say, compared to what? Death? Because that's the only choice we have, premature death, if we don't learn to understand how many carcinogens we're taking in every day, breathing, eating, drinking water. Here's another one, hydrazine. Food additives, photographic supplies, herbicides, pesticides, textiles, drugs, or plastics. Have you been around any of those today? Do you have a cough? You don't know where it comes from? Are your liver enzymes high? Do you have kidney damage? I don't know. Do you? Because that's why we recommend doing not only kinesiological evaluation, but blood, hair, saliva, whatever it takes to evaluate the patient. Again, that's why we teach it in our seminars. You can eat and drink small amounts of hydrazine on a day-to-day basis and not even know it. You get very much so, you get nausea, vomiting, uncontrolled shaking, inflammation of the nerves themselves, drowsiness, and coma. Now, usually somebody comes in with a diagnosis. This diagnosis is a named and blamed disease. In chiropractic, being that's my training, we call it a dis-ease. It's not easy. It's dysfunctional. I treat function, not disease. But how can I treat function unless I detoxify the sources of glue, antifreeze, paint, cement, ink, windshield wiper, solvent, and other industrial uses where I might have picked up methanol or PVC contaminants or all the other things we've talked about. Because if methanol is in there, neurologic damage, blindness, lung and gastrointestinal problems, irritation of eyes, skin, upper respiratory, the story goes on and on. So this is nitrogen dioxide. It shows the different areas of greater concentration. You can take a look at that and look at the sources. Nitrosamines, very high in rubber industry, tires, baby nipples, and pacifiers. We're feeding our kids out of this. I mean, what's the options anymore if mom can't nurse anymore, or she never did to start with? We get in soaps, cosmetics, tobacco smoke, food and food containers, packaging material, on and on. So we must have a way of triggering the release of these from the body. The ozone, we're getting ozone contamination from the ozone layer being taken away on top, and that's winding up on the bottom where we're bringing it in. More to be discussed on that when we have more time. But smog is harmful because of all of this that it does. In there, the ozone is now in the atmosphere, is low, and you're breathing in. Nitric oxide production, sunlight breaks down nitric oxide. Ozone is formed by oxygen atoms being O3. So you want the layer above you. You do not want to be breathing this in. But it happens every day because of what we've already gone over. What about the PBBs and PVCs? They are everywhere. They are flame retardants. All of your rugs, all your plastics, all your cars, all your airplanes, clothing, furniture, upholstery, electrical equipment. I mean, when you turn on a new piece of equipment, like a new computer, you can smell that. That's what you're getting. You're getting polybrominated biphenyls in your lungs, and when they get in your lungs, it goes all over the body, and it is, in fact, according to the research, causing genetic damage, cognitive retardation, vitamin A dysregulation, immune depression, peripheral nerve damage, liver damage, respiratory problems, excess pigmentation, and on and on and on. So if somebody comes in with excess pigmentation, I get questions that once in a while, say, well, what do I do for this? Well, what's the cause? We always say, I am a DC, a doctor of cause. I have to look at the cause, and to do that, I mean, I don't know how I would do it without some form of muscle testing or leg check, because, or the ASA machine that I have, I can check 1,000 things in 5 minutes with that. Muscle testing wise, I could check 10 maybe. Or if I did all the testing for all this, it'd be $15,000. So we need to use every trick of the trade that we have to evaluate these different things that we're going over here, like the phenol sources, disinfectants, insecticides, throat lozenges, food additives, tobacco, marijuana, phenolic resins. See, why do you keep bringing up marijuana? Well, it's legal in Colorado where I live right now, and some people use it whether it's legal or not. It affects irritant and corrosive substance by all different areas, inhalation, oral, dermal, and it can cause everything from necrosis to nausea to coma. So check for the phenols, help to detoxify. Styrene, photocopier, copy paper, and I mean, I said there's a copy right next to me. Brandy has her own separate office. She has one in there as well. You run that, you smell that stuff in here. So you really have to be careful to get rid of it. Literally, styrene, which is everywhere in there. Look at all the different contaminants you can get for insulation, fiberglass, plastic pipes, automobile parts, shoes, drinking cups, carpet backing, packing material. It causes literally genetic mutations. You can take care of a genetic SNP for polymorphism. You cannot reverse a mutation. You can get epigenetic expression better, but it's very hard. and you can never change back that mutation. Once that person has it, it never goes away. Chromosome aberrations, interference with liver enzymes, dermatitis, skin, nasal, and on and on. Trichloroethene, sources, dry coating painting, spray painting, glue, dewaxing, degreasing agents, insecticides. What do they cause? Memory, cardiac, heart attack, nausea, dizzy, vomiting. Let's go on. What about vinyl chloride? Everywhere. Plastic wraps, PVC pipes again, connectors, packing material, wire, cable, groundwater, vinyl records. Groundwater, yes, we're finding these things are showing up in the groundwater. Effects, a long list. EPA considers vinyl chloride to be a known human carcinogen, and yet it's everywhere around us. Now, hopefully, you're starting to understand why we're agonizing over this, and we're going to run out of time, so I'm going to have to go through some of these very fast and just show you what you can go back and look at, because I want to get into some more of the treatment before we finish here. But please understand the vinyl chloride monomers are everywhere, in Japan, in Western Europe, in the United States, in Canada, and China. We are picking up toxins everywhere. Xylene, industrial solvents, synthetic intermediates, paints, coatings, paper, smog, groundwater. It affects everything from the nervous system to the respiratory system, and it causes hepatic and renal problems. Many people die from hepatic and renal problems, and if you strictly try to treat it, I mean, as I said, we have max liver, we have max kidney, we have max male, we have max female. So when I formulate a product, I make it by a name you can remember. You want to treat the whole female system, use max female. You want to treat the whole male system, use max male. Well, why would this is all with males, yeah? Well, there's just as much andropause as there is menopause. There's just as many problems with the male sperm count as there with the lady and the ovum. They're having trouble getting pregnant. They're having trouble erectile dysfunction at a very young age, as I mentioned earlier. And a lot of it's coming from the chemicals. Please take heed of what we're talking about here. Come to seminars. Let us show you how to identify and detoxify. Get your fed infrared sauna. Use your laser every day, because we are being poisoned on a day-to-day basis. We can't stop until we talk about heavy metals. They're everywhere. I have formulated multiple homeopathic detoxifying heavy metals, such as antimony, arsenic, cadmium, chromium, copper, lead, manganese. We have many of these. You can't have all of them, but we have many of them. We'll show you how we evaluate the patient, yes, with hair analysis, but also with muscle response testing. Even small amounts cause small problems. Large amounts can kill you. And so we use many different ways of evaluating and treating and detoxifying. But we have patients who have been diagnosed with potential leukemia or leukemia that have heavy metals, that have the halogen, toxic halogen levels in the body. And we trigger these out first, and we do use infrared sauna and laser and foot bath in conjunction with the heavy-duty nutrition, such as Nerve 2, Lipocol, Chelex, and the patients start getting better, and they don't continue to have the symptoms, and their blood clears up. I don't treat a dis-ease. I don't even treat a disease. I treat function. That's my job, DC, doctor of cause. And so we treat function to get it better. But if you have heavy metals, you have toxic halogens, you malfunction. So we evaluate and treat these. And we'll show you how you can trigger the release of them with these homeopathic preparations. And we use a multiple that has 12x, 30x, 200C, and 1M. Very powerful homeopathics that trigger. It's called a homochord. It's like a multiple homeopathic versus a singular strength. If not, you would have to evaluate every patient and treat every one of them for each toxic level they have. The homochord helps to trigger the release of any aluminum in the body if that's what shows up. So we'll show you how to get a lab hair analysis. They're very good for toxic metals. They're very inexpensive, and we compare that by computerized reporting systems, comparing head to the blood problems that people have, to the hair, I'm sorry, and we use computerized testing for hair and blood. And we'll show you how you do that, how you sign up, how you get the reports. I mean, we may do 20, 30 reports a month of evaluating patients. If we see a complicated patient, let's say they're referred to us and they have a real complicated blood study, I have never seen the patient that didn't have heavy metals and or halogens, ever. And the complicated cases that we've helped from diagnose things like lupus or MS have these kinds of toxins. We get rid of the toxins, and it's not our fault. The condition improves. We didn't treat the condition. We treat function. If function improves, many conditions go away. But I tell you, of the hundreds of MS patients I've seen, I can only think of 2 we were not able to help remarkably. And those have been years ago before I had anywhere near the understanding that I have now of what we're presenting to you today. This particular presentation was put together only a few weeks ago to give you an overview. But mercury is more toxic than lead, cadmium, and arsenic. I mean, there are 714 hazardous waste sites nationwide with metallic mercury in it. You can drink it, inhale it, you can contact it. Every way you can see here, animals, birds, foods are being contaminated from it. I can't go over these in detail because of time. Go back and read the different forms of methylmercury and the health effects. It definitely affects the fetus, infants, children. It impairs neurological development. And actually, go on YouTube and tap in mercury degeneration. There's actually a website that'll pull up. It'll show you when they introduce mercury into where they have a nerve isolated. It literally eats up the neuron. It's unbelievable. Impacts your thinking. Exposure of high levels can cause neurologic and kidney disorders very rapidly. So methylmercury affects the fetus, and they have all the documentation for this. We were told for years there was nothing wrong with this. Oh, once you took it out of the mouth, then it became a toxic element, and you had to spend a lot of money to get rid of it. But as long as it's in your mouth, it was safe. Unbelievable. The kinds of symptoms we get from even small amounts of mercury in the body are tremors, emotional problems, nervousness, excessive shyness, insomnia, neuromuscular changes, weakness, atrophy, headaches, disturbance of sensation, cognitive function, on and on and on. So please look this over and get an appreciation of everything we've given you here of the damage that you get from mercury. Have over half a dozen slides here of the different problems in adults and in children from mercury exposure. Visual cortex, cerebellum, root ganglia are all affected from mercury poisoning. And if you're very old, you actually have some mercury in your mouth. If you're very old, you probably saw a thermometer break open and played with it in your hands. Lead, same song, different verse. It literally is found in paints and gasolines and mining and commercial operations. It's only been in my lifetime that they took lead out of gasoline, and I treated some mechanics in my career that were deathly ill. And until we learned how to get rid of the lead in the body, it was almost impossible with anything we did to help them. But once we started using IV chelation, oral chelation, and Chelax is a wonderful form of oral chelation, along with supporting the liver and the kidneys, max kidney, max liver, while this is going on. You have to give them an essential fatty acid. I love lipocol because it comes from krill, and it's like one little small capsule that's like 5 of fish oil. I handle it better. But fish oil, flax oil, borage oil, different oils, essential fatty acids help the body to get rid of this lead as you release it. And once we start using one homeopathic metal, it starts triggering the release of other ones. So be aware of that. Here's the sources of inorganic lead and of organic lead. It's in the house, it's in the home, it's in industry, it's in batteries, it's in mines, smelters, waste sites, garages, dust. We're getting it everywhere. So please be aware of that. Lead enters the cell. This gives you, tells you how the calcium channel is stimulated by the G protein binds, and it tells you the whole story here. Please take a look at that. The lead effects of blood, mineralizing tissues, bone and teeth. Most of the lead is stored in our bone and teeth. And so as you start releasing this from the body, a lot of times bone conditions and teeth start healing and clearing up. So make sure you're taking Chelax and lipocol when you're doing the heavy metal homeopathic releasing. Very important. We have all this written up. Don't skip here. And once you start doing it, you need to follow through with it. Lead in the blood, approximately 99% of the blood, lead in the blood is associated with red blood cells. And we know with anemia, if you're not carrying oxygen to the tissues, how do you get well? If you're not carrying the carbon dioxide and other poisons away, how do you get well or stay well? The most important thing, as I said, is oxygen, and we're called oxidation reduction animals. It has to do with the blood having good oxygenation and carrying away the toxins. Number 2 is methylation. Heavy metals and these toxics we're talking about affect both oxidation reduction and methylation. So lead in the blood causes all of these different effects through there. So we get time to go back and study that and look at it. But you can see everything from edema in the brain to encephalopathy to reversible brain damage can be caused by lead in the blood and onto the brain. It affects the proteins and the enzymes and metabolism, apoptosis, muscle contraction, intracellular movement, nerve growth, immune response. Gang, we are onto something really big here. I don't even know anybody that knows all of this besides us that has the homeopathic to be able to get rid of it. It is what we have made through bioenergetics, through Zymogen, of the elite nutrients made in a special way, formulated to help get rid of this from the body. But follow the protocol with the Chelax and Lipical. I keep saying it over and over, and Xenoprotect and the other nutrients that the body tests for. But also you have to make sure you're methylating properly. So we check every patient, and let me just walk you through right here, in case some of you have to go. We've been right at an hour now, and I'm going to go a few minutes longer, but here's the scenario. Patient comes in, and we do our case history, we do our patient evaluation, we do our careful questionnaire. We may have blood, hair, saliva. We may have different things to look at. But when it comes time to checking that patient, we use muscle response testing, or we use hair analysis, whatever testing you have. And you check the patient to see what they have. And let's say they show up lead. If they have lead, then I'm going to give them homeopathic lead. And this is in the Homocord. I showed you the picture of a minute ago. This is going to start triggering the lead out of the body. Well, the lead has a very heavy atomic weight. So as it starts triggering the release of lead, it starts releasing other heavy metals from the body as well. So I'm giving the homeopathic lead, which triggers the release of lead that's trapped inside the cell. Once it comes outside the cell, where do you want it to go? You want it to go completely out of the body. How do you get it out of the body? Well, you use Lipical, or use a fish oil, and by that nutrient inside, it helps to bind with the lead and to be excreted in urine and feces and breath and sweat. Now, if I possibly can, we have an infrared sauna in the clinic. We have an infrared sauna in my house. I have a cabinet infrared sauna there. And so we also have them get in your infrared sauna as often as possible. If someone's really, really sick, I recommend they get their own and have it at home. And they can get in at least once a week or twice a week. Because when you heat the cell up, instead of dumping only 2% toxin, you dump up to 15% toxins. So you mean you're giving them homeopathic lead, you're giving them Chelax, you're giving them Lipical, you're saying you need to go ahead and if they can do infrared sauna, even laser and a foot bath, the answer is yes. You say, but that's a lot to ask a person to do. Well, the kind of patients I see, the reason I receive 50 to 70 new referrals every month without advertising, because that's what I did do to people, and they came in with MS and lupus and every other named and blamed condition that I did not treat. I treat them in detoxification, like I'm telling you right here, and the majority of them got incredible improvement in the conditions that they came for by treating function. So please be aware of that. Lead has neurologic effects, and everything from sex drive to depression to mood changes, motor performance. And if you do this on any of the heavy metals, you're going to find this. You need to lower the exposure, and at the lowest exposure even, they can have memory problems and lower IQ. They can have myalgia, paresthesia, fatigue, irritability, and lethargy. In moderate exposure, they can have even full-blown arthritis and tremors and all kinds of diffuse pain throughout the body. High exposure, even paralysis, encephalopathy, and they can have a lead line in the gingival tissue, etc. So we look at all of it. Here's a picture representation of how lead can affect the head, the gut, and when you affect the gut, then you affect all the immune system, which can affect anywhere in the body. Study these over again when you have more time and really look at them. Cadmium, again, same sound, different verse. It's a heavy metal that mainly is brought to light in the refining of zinc ores. Again, many different problems come from cadmium. That's one of the things that we routinely test. It's known to be in phosphate fertilizers, sewage sludge, the nickel-cadmium batteries, plating, pigments, and plastics. All kinds of problems result from cadmium. So this gives you the major sources are the nickel-cadmium batteries, which probably every one of us use almost every day of our lives. Cadmium health effects are massive, from liver to kidney to lung. Cadmium toxicity, respiratory, reproductive, kidney, skeletal, as we mentioned. This shows you how literally you can have a buildup in the alveoli of the lungs from cadmium toxicity. Arsenic, colorless, odorless, comes from the ground, comes in industry, used in some of the insecticides and pesticides out there. Very, very toxic compound. So study this over when you have time. Found in rice, chicken, cooked spinach, grape, shrimp, fish. Unbelievable how many different ways we're picking up arsenic and the many different ways it's affecting us. Copper. Copper is necessary for the desmosine living platex girdle molecule that's in the body, but in excess, it's a poison. All of the trace elements and even some of the metals do have some minor use in the body. Some of the trace metals have major use, but even some of the heavy metals, like arsenic, is found in small amounts, may have some good use in the body. But every metal, or even a trace element, has a two-edged sword. So a good example of this is copper. Not enough copper, you'll have a heart attack or a stroke. You literally stroke out because the blood vessels have no elasticity. You get too much copper, you can go crazy, it burns up your adrenal glands, and on and on and on. So it's very important that we measure these elements and these metals, and we release them when they're in excess, and we supply them when they're in deficiency. Aluminum is everywhere, and it is in industry all over. And some of the acid drinks we put in aluminum cans, that we drink it, you get heavy exposure there. But as it shows here, you get oral, dermal contact, inhalation contact of aluminum. It causes, this is a brief list of what's been associated with aluminum toxicity. Alzheimer's, ALS, sorry, my kids call me old timers, so it slipped out. ALS, anemia, hemolysis, you name it. Look at all the different things that can have from just aluminum toxicity alone. That's my older children. They have no disrespect. I mean, no respect for their elders. My oldest son is 43. He's an orthopedic surgeon, or 42, I shouldn't say 43, 42. And he is an orthopedic surgeon. His wife is a doctor in PT. Number 2 son is Brett, who's a chiropractor and does all of this work and helps me teach it. And the number 3 son is a dentist and practices in Alaska. Brandy is a billing, coding, profitability expert. My wife, probably one of the smartest people I've ever met, and she correlates all this information and shows you how to do it in proper billing, coding, and compliance and all of that thing. So we eat, sleep, and drink what we're talking about here. Chromium, you don't have enough chromium, you die. The wrong valence of chromium, you die. So it is very important that you do not get hexavalent chromium. It is carcinogenic. But small amounts of the right chromium is very necessary for blood sugar balancing, called the GG factor. Sources are listed here and all the documentation for it. As you can see, we have much information for you to go back and review. Far infrared, the reason we use it is it helps to release these stored toxins in the body. Documented: lead, mercury, chlorine, carbon dioxide, SO2 are released in the body by heating it up in the far infrared sauna. We will show you in a minute what far infrared means. But inside this electromagnetic spectrum, far infrared heat is manufactured by the sun. This portion of the sun's invisible band is very healthy, and it literally helps the body heal from the inside out. It literally has direct molecular excitation to dump the garbage out of the body. And it literally helps the tissue cells to open up and to get rid of the bad things. The body absorbs far infrared heat waves, and these encourage the transfer of water and these cellular toxins right through the membranes and out of the body. Once this happens, the cellular membranes are hydrated, and the blood flow is enhanced and ultimately assists with the assortment of biologically beneficial healing functions in the body. So far, we use infrared lasers. We use infrared saunas. I use both of those. I also use red, violet, and other laser as well. And I will laser while I'm in my infrared sauna, as I mentioned, so I give a multiple spectrum of messages to my cell. The far infrared sign is here. As you can see, X-rays and ultraviolet are down here. X-rays are very harmful. Ultraviolet are good in a little way because they're actually good for fight off infection. This is the visible spectrum that we see from violet to red. Underneath violet is ultraviolet. Above red is infrared. So near infrared is in this spectrum. Medium infrared is in this spectrum, and far infrared is in this spectrum. And the far infrared sauna is what high-tech uses, and it's the only the one that I use because it gets me the best results. The most notable characteristics of far infrared heat is its ability to penetrate below the skin. It actually goes deep into the body tissues. When this occurs, it literally constructs a natural resonance. And this resonance has numerous advantages in the body. When you measure it in wavelengths and microns, 3 to 50 micron range is the best for absorption. These rays penetrate into the body where they gently elevate the body's surface temperature and assist in expanding those capillaries. The capillaries open up, and I'm going to use the word vomit out the bad guys. That's why it's important you want to use Chelax and the Lipocol along with this and whatever heavy metals or toxic halogens that you found, so you trigger the release of them much better. And by getting rid of those toxins, they go right out of the body and out into the air, and you can get rid of them. The FIR stands for infrared, right? Far infrared sauna. And it's in a resonant absorption. They're selectively absorbed by the tissue. So not all of them get in, but many of them do. And this internal production of infrared energy that literally occurs within our tissue is magnified as healing response. And by being in the sauna, you're closed off, you're sealed off, you only have a little air you let go out, but it heats your cells up. And this phenomenon is called resonant absorption. The infrared waves literally go into the body and start that healing in there. And the far infrared is this spectrum here. What changes the colors is the wave length. And so these wavelengths are non-visible. Ultraviolet is non-visible. Once you get here, this is the visible spectrum, and then you go out to far infrared, which is out of the visible spectrum, right at the edge of it here, where the greatest amount of healing takes place. This is what my unit looks like. I just got out of a few hours ago. So the far infrared sauna mobilizes toxins from the fat cells, and we know most of the toxins are stored in the fat. How do you get it out of there? Well, with the homeopathic, but the laser, and particularly the far infrared sauna, is the best way I've ever found. And again, normal sweating gets only 2% out. Once you heat that cell up from the inside, 15% toxins are eliminated from the body. They're invisible waves of energy. They literally absorb by the tissues, the muscles, the tendons, all the way down to the cellular level. Significant benefits are noticed throughout the body. Patients say, well, you know, I feel foggy-brained, I'm tired, my muscles are sore. I use the infrared sauna for all of those things. We have used it in the Brimhall 6 Steps to Wellness since 1986 and have found incredible results with it. Like I said, right in Dr. Brett's office, he has the sauna then, and we don't even want to have one that we can't get to every day, so we have one in our home. This is documented, researched improvement that they have found from using far infrared detoxification. It removes toxins from a cellular level, improves cellular health. It helps the nervous system to heal and repair, increases circulation, improves digestion, normalizes blood pressure, enhances the immune system. I won't read all these. You can go back and do it. But how does it do that? Because it helps to release all of those toxins we just went over for the last hour. It helps to improve the circulation to all the organ systems of the body, and it helps to mobilize the nutrition that you're taking into the system. So here's all the areas there, and I know it's too small to see, so I've broken down to the detoxification list that has been proven through studies to be released by far infrared sauna. So I think you'll see why I don't want to go 1 week without an infrared sauna. Now here's a sweat analysis that was done on one physician, only 35 minutes long. When they did a complete sweat analysis, they found out they released lithium, sodium, potassium, rubidium, cesium, magnesium, calcium, right on down the list. And you say, now wait a minute here. A lot of that stuff is really bad, but if my chromium is low, I don't want to release it more. My lipids, no, I don't want to release it more. What am I going to do? But I'm sure glad I got rid of the uranium and the thallium, because well, that could cause cancer. Well, what do I do with the good guys that are going out? That's why we use Minorex. Minorex is a nutrient that's enzymogen. We'll have it added to the bioenergetics line, and you want to take 1 to 2 of those a day when you're doing any of the heavy metal toxic release system. So Minorex is very important. So you're really putting the good guys in as you're getting rid of the bad guys. You cannot do a foot bath or an infrared sauna or any even Chelax and not take some of the good minerals, some of the good metals with the bad ones. So you always supplement with the good guys where you're getting rid of the bad guys. Far infrared sauna, as I mentioned, does 15% toxins in sweat. And these are some of the nutrients that we use on a daily basis. I mean, I'm not going to go a day that I don't take max liver detox, at least 1 to 3 a day. So this morning when I wake up and I take my daily nutrition regime, I take max liver detox. I test myself and I take the homeopathic metals or the halogens of the day. I never take over 1 metal a day. I never take over 1 halogen a day, but I can rotate them. I take a lipocol 2 to 3 times a day because I want to have my cell have the greatest amount of length and strength. I want the ring that protects my cells. We have phospholipid rings around our cells. Plants have cell walls. We do not. We have this phospholipid ring. 5-tetramethyl hydrofolate or methyl protect. We need one of those 2 every day, in my opinion. Maybe you could get away with B active if you're pretty healthy. If you look at the tongue and it has cracks in it, that's B complex deficiency. If you muscle test or you do any kind of testing at all, excuse me, and you have a methylation problem, most of the time, up to 50% of Americans need a activated form of folate and an activated form of all the nutrients that help you in methylation, which is the methyl protect. In the presentation they did on methylation, he was stating we're getting too much folic acid, regular folic acid, which is actually binding up the pathways. But if you have 5-methyl-tetrahydrofolate, then the body's an activated form. But when we muscle test, sometimes the body will choose 5-MTHF, sometimes it will choose methyl protect. Rarely will it choose both. So you need to ask the body which one it wants. Sometimes it will choose B active. Sometimes, though, the body cannot tolerate either one of those unless you give SAMe, and he went over that. Sometimes SAMe, along with trimethylglycine, are necessary for the body to do methylation. And if you do a regular nutrient like 5-methyl-tetrahydrofolate and you don't have SAMe, they'll actually get worse. So please ask the body, do you want methyl-tetrahydrofolate, or do you want methyl protect, and or do you need SAMe along with that? Now, mitochondrial resuscitation is very, very, very important. And AK boys use this muscle test, a little different thing, but I have found that max mito is the answer to prayers for mitochondria. If you will muscle test somebody and just use a group muscle or an individual muscle, you should be able to test it fairly rapidly 10 times in a row. That muscle should stay strong. If it goes weak, and you're going to find 7 out of 10 people do, they have a mitochondrial problem. I mean, I ride a bike every day or exercise every day. If you push too hard, or if you push hard enough to get the kind of effect you want, you actually give some uncoupling of the mitochondria. So you have to have all the nutrients are necessary to rebuild that coupling, and for mitochondrial resuscitation, that's max mito. So check every patient comes in tomorrow, rapid muscle test them, 10 muscles, even a group arm test, 1, 2, 3, 4, they should hold strong in all 10. If not, just put a trace of max mito on the tongue, or even have to just hold the test vial in their hand. They'll go extremely strong. So any kind of a degenerative disease, according to the literature, all degenerative diseases have mitochondrial resuscitation problems. So we use max mito on those. Again, S-acetylglutathione, and it is a very, very effective form of glutathione, and that also helps in mitochondrial resuscitation and in detoxification. I didn't put NERF2 on here. I ran out of space, but that's also another thing that we use in our methylation pathways, detoxification, and immune building. So I highly recommend you get How to High-Tech Health. You can go on Brimhall.com if you don't find this and get to this. This is their 800 number. I use them. I have negotiated a $500 discount for all of you that might want to use infrared sauna. And if you your patients want to use it, they'll also extend this discount for that. So please contact them. Add this to your armamentarium. Contact your bioenergetics and Zymogen Rep, which is the same rep, and find out about these nutrients. There's nothing like them out there. Brian spent $13 million building the best facility for nutraceuticals in the world. I mean, I wished he had it. I would like to be happy with Western Nutrients, but it's the only company I know that can do these products in the format they are with the kind of facility that he made there. It's not duplicated anywhere in the nutraceutical world. Well, gang, I appreciate you staying with me. We're going to sign off now. We went an hour and 22 minutes. I apologize for those of you who are hungry, but this is very important. We'll be back on the third Thursday of next month. Look on Brimhall.com. Look at the upcoming seminars that are coming to you. We have about 10 or 12 throughout the remainder of the year. Every week we put out the puzzle piece. Jason and Solitaire are on call. And on every puzzle piece, my cell phone is there. I don't hide. My email is there. Please get your questions answered if you can on the website or with one of them if you can. But if not, I'm here to serve you any day in any way. Good day and God bless you all. Bye-bye.